SARS-CoV-2 Delta variant is a variant of lineage B.1.617 of SARS-CoV-2, the virus that causes COVID-19. The Delta variant of COVID-19 was first identified in India and is known as B.617.2. Delta is causing a spike in COVID-19 infections among unvaccinated people and has become the dominant variant of the new coronavirus. The World Health Organization, WHO, named it the Delta variant on the 31st of May 2021. Viruses are meant to mutate all the time. From the time the world got infected with it, it has been mutating. These changes are unpredictable and resulting in various other infections, making the disease more infectious and threatening. This time, it has mutated and formed a variant, which has been named as Delta variant. By the 13th of May 2021, more than 4,500 sequences of the variant had been detected in about 60 countries. In countries other than India, the first cases of the variant were detected in late February 2021, including the United Kingdom on the 22nd of February, the United States on the 23rd of February, and Singapore on the 26th of February. WHO says Delta COVID variant has now spread to 80 countries. And it keeps mutating. Deltaplus is a sub-lineage of the Delta variant, which has acquired the spike protein mutation called K417N. In simple terms, this means that deltaplus is a further mutated version of Delta variant. Recently, a new variant of the virus called deltaplus has come under global watch. Out of the details emerging about the deltaplus variant, it has been found in 9 countries. As of June 16th, at least 195 cases has been found in 9 countries. Britain reported 36 cases, the United States 83, Portugal 22, 18 cases in Switzerland, Japan had 15 cases, Poland 9, Nepal 3 and India reported 8 cases. Cases in India have now increased to 40. The world is facing a widespread crisis triggered by the Delta variant. Lakhs were infected and thousands died so far. While the countries across the world are still dealing with the Delta variant concerns, the further mutated form Delta Plus has added to the challenges. The mutated variant, experts point out, has increased transmissibility, higher binding capacity to the lung cells, and resistance to monoclonal antibody treatment given as COVID-19 vaccine. This is why it has been termed as a variant of concern by the World Health Organization, WHO. The Delta variant of COVID-19 has changed how the virus is spreading and the measures governments have to take to stop it. It has also changed the symptoms, with a headache, sore throat and runny nose now the most commonly reported. In case you experience any of the mentioned symptoms, do not ignore them. Be in home isolation, and do get yourself tested. Take utmost care and maintain discipline, as it is required to be safe. Mainly, doctors are using antibiotics for the treatment. Studies on the new variants are still going on to draw conclusions. Until then, the only way to prevent this is to get vaccinated as soon as possible. This would reduce your chances of getting sick. Talking about the effectiveness of the COVID-19 vaccines, ICMR found that recipients of Covaxin were able to neutralize Delta variant effect, although with a lower efficacy. A study conducted by the Public Health England has found that both Pfizer-BioNTech and AstraZeneca-Oxford, Covishield, vaccines provide a 33% protection against symptomatic disease caused by the variant after the first dose. In June 2021, Public Health England announced it had conducted a study which found that after 2 shots, the Pfizer-BioNTech vaccine and the AstraZeneca vaccine are respectively 96% and 92% effective at preventing hospitalization from the Delta variant. While the center has said the COVID vaccines are effective against the Delta variant, experts have raised concerns about their effectiveness against the deltaplus variant. Important is to note that this variant is rapidly spreading around the world. Experts say that Delta variant is more transmissible than other variants so far. The earlier symptoms such as fever, loss of taste, and smell associated with the virus have changed. This is showing different symptoms such as headache, sore throat and runny nose. People may be more likely to be hospitalized with the Delta variant. Now, in order to safeguard yourself from the current variants and also prevent future new variants of the COVID-19 virus, current measures to reduce transmission, including physical distancing, wearing a mask, frequent hand washing, good ventilation, and avoiding crowded places and staying at home, continue to work. Additionally, get vaccinated as soon as possible. Vaccines are a critical tool in the battle against COVID-19, and there are clear public health and life-saving benefits to using the tools we already have. We must not put off getting vaccinated because of our concerns about new variants, and we must proceed with vaccination even if the vaccines may be somewhat less effective against some of the COVID-19 virus variants. We need to use the tools we have in hand, even while we continue to improve those tools. We are all safe only if everyone is safe.